Okay, we're going to go ahead and get started then. And we want to extend a warm welcome to everyone here. This is Bernard Dean up in the Atlanta, Georgia area. I'd like to start the program out by saying today, I don't know why, but it seems like there's an escalation in people that's becoming concerned about their health. That's new terminology with healthcare that comes out here. It's called self-care. Personally, I'm a retired firefighter. I was a captain paramedic here in the Atlanta area. I've been a paramedic for about 30 years. I always highlight to people, though, even though I'm a paramedic, when it comes to medications, they have their benefits. But what I found as a paramedic is a lot of times it's good to look at the side effects of these medications because there's an old saying, I always say it, if the juice is not worth the squeeze, sometimes you might not want to buy the fruit. And so, whenever it comes to your health, we do have enough information on the internet when it comes, especially AI, artificial intelligence, as well as Googling, and you get a chance to actually learn about things even before you come on programs like this. But one of the programs out here that most people don't know about is a program that involved, to me, an incredible scientist. In fact, one of the best scientists on the planet with myself, I've been affiliated with them about 2.5 years. I had no intention, actually, of being a part of this company, but the products worked so well for me that I felt like I needed to share it with people that really was looking for health to improve their health. And as a result, my wife and myself, even though I'm a baby boomer, my wife and I have gotten some incredible results with these products. And as a result, we did a share and care program. And the results were we literally have hundreds of people that have called us up that had no inkling that there was something out here like this. They called us up and they thanked us for introducing them to this micronutrients. I especially have a couple of people lately that actually the doctors had basically sent them home with no hope. And as a result, I put them on a regimen of the program of the micronutrients you're getting here about. And these people, even though they were very skeptical, they not only got their health back, but they can't stop telling people about these products and this company. So today you're going to get a chance to hear the myth, the legend, the man, Dr. Kedar Prasad. And we're happy to have Jonathan Jones, who actually introduced it to me. And for the next 1 hour or approximately 55 minutes, we're going to invite you to take notes. Listen, this is going to be a recorded program. So please just pay attention, and you're going to get a chance to hear it a little bit later on as they bring to us about micronutrients and medications and the side effects. Which one is better? Well, for the next 55 minutes, you're going to learn which one is the best course. Jonathan, take it away. You got our attention for the next 55 minutes.
Hey, Bernard, thank you. Thank you very much. We've got a very interesting lineup of information today. Thank you so much for getting all the seats filled and letting everybody know that they got a reason to be here and a reason to go ahead and reach out to people that they care about. So we do wish to urge you to go ahead and reach out to somebody that you care about because they're going to get an eyeful and an earful today, maybe an education that they never expected. As Bernard mentioned, my name is Jonathan Jones. It's my pleasure, my privilege to be your host and moderator for this afternoon. I'm excited to be a part of this discussion. I'm nobody special. I have to just tell you that right from the beginning. I just happen to know who Dr. Prasad is. Just like many of the co-hosts that are here, we're happy that he's willing to join us. Back about 20 some years ago, actually it's been more like 30 years. My wife and I decided we didn't want to get the diabetes that we saw in our families. It was horrible. I grew up, watching that and not realizing that what was actually killing my mother was not so much the disease itself, but the side effects of the treatment. And there's so many other folks that have had problems that they've suffered with side effects of medication. Of course, it did benefits to her. I'm not, trying to say that medication is bad. Now, our presentation is going to help you to see that. So we're not trying to say that medication is bad, but sometimes we blame the disease for everything that we see going on in people that we care about. And sometimes they're not fully, the disease itself is not solely responsible for what's happening. And that's what I finally learned in my mom's case. But just the same, I know a lot more now, and have gotten to see that there are things that you and I, average people, can do to change the impact of the side effects on us. I still never will forget this one story. A young man who was trying to change his life. I say young man, he's probably in his 50s now, but at the time, this goes back some years, he was trying to change his life. It was pretty bad. He had a terrible, abuse habits. He didn't really have a home to speak of. But we got to talking, and I was doing a lot of volunteer work and social service type work in the ministry, and began to help him to rethink his priorities in life. And I noticed that he was using a medication every single day. And I just asked him a question: have you ever, checked the side effects of that? He said, no, the doctor said I need it, so I'm just taking it. I said, well, just ask the pharmacist one day to give you, a list of the side effects of that. And about 2 weeks later, the next time I saw him, he came back, and I never saw the side effects myself. I didn't look at it, but he says, I read the side effects. It says one of them is death. It says this thing could possibly kill me. He said, why did you give it to me if it could cause death? I said, listen, look, I'm not a doctor. I don't know what to tell you. I'm just letting you know that you should be doing something to make sure your immune system is strong so that you don't experience the worst of the potential side effects that could come from certain medications. But he read every word. And when he saw that word death, boy, he wanted to know more about what his options were. So anyway, I tried to help him with that and gave him some tips as to what he could do to make his immune system work a little bit better. And it did. He was very happy with that. We're going to talk about how we unlock the power of micronutrients and potentially reduce the side effects of medication. And yes, we are going to be able to hear from Dr. Prasad. He has come away from his little hiatus and decided to go ahead and help us with this discussion. But before we go down that road, please realize that the FDA has not evaluated the statements that we're making. You're going to maybe hear some testimonials. We may have one or two that we'll share with you. In fact, there's one really outstanding one that is kind of scary, but had to do with breast cancer, and we might share that one with you. But anyway, testimonials are anecdotal. Results are atypical. What happens to one person may or may not happen to you. Neither the Healthcare Support Association of America, Engage Global, Dr. Prasad, Jonathan Jones, nor any of the authorized representatives are making claims that any supplements recommended will treat or cure any disease state. This presentation that you're hearing is for information and educational purposes only. It's not intended to be a substitute for a visit to your doctor. We recommend that you seek the competent medical advice of professionals that you trust. In all cases, that's our urging. However, you are going to hear things that has been carefully researched. The documentation exists in the public forum to back it up. So we're only sharing this for your education and your information purposes only. And remember, you can use this when making decisions about your health and well-being. Take it into consideration at the very least when you're making decisions. So we're going to have a little discussion here with Dr. Prasad. Dr. Prasad has a storied background. He's forgotten more than most of us know, but he was a professor of University of Colorado School of Medicine for some 30 years. He was invited to be a member of the Nobel Peace Prize nominating committee, and quite a long list of many other things. One of the most exciting parts of this is that he was the one who was the world's first radiation biology PhD. So that means that this man decided that, somebody ought to do something about the potential harm that radiation could have on the body. And was he clairvoyant? I mean, was he a visionary that he knew that somehow we would all be being bathed in 5G radiation today? How in the world did that man jump in the front of the line and say, this is the field that I want to become the expert in? And so he chose that field of expertise, which, please keep in mind, folks, that's a benefit to you and to me, that he decided that that field of study was important because we are all being saturated with a form of radiation, a form of it. And even to this day, they use radiation to treat certain cancers, even though they know that it causes cancer. It's a treatment for cancer. So anyway, we'll help Dr. Prasad maybe help us to understand how it is and that the body can be helped to be protected from even the low doses of radiation and the high doses of radiation. The the minimal potential side effects that we could have from medication and the worst of the potential side effects of medication. Dr. Prasad will help us with that. He also discovered the anti-cancer potency of vitamin E succinate. So please make a note of that. Take a screenshot of this if you would, by the way, because there's a bunch of different kinds of vitamin C's. I think there's 6 total, but Dr. Prasad is the man who figured out, the scientist who figured out that vitamin E succinate just happens to kill cancer cells. It does the same thing that all other vitamin E's do, but it also just so happens to kill cancer cells. And he went on to discover many other things. He's been published in peer-reviewed publications nearly 300 times, and he's authored many books on the subject of micronutrition. So I'm happy to introduce to our discussion and to welcome to our discussion Dr. Kedar Prasad. And let's chat for just a couple of moments. Dr. Prasad, welcome, sir, to our discussion. And thank you for joining us.
Yes, it is always a pleasure to talk with you and engage family. It is my privilege and honor to do that. And so anybody have any question, I always glad to answer if I can. And if I don't know, then I will look into it and then I will answer it.
All right. Well, fantastic. Well, we're looking forward to that because I have a couple of slides, Dr. Prasad, that that discuss this matter of side effects. And I know that I didn't show them to you, and so you haven't seen them. But there's nothing here that I think will is a shocker. But it could be that you could give us some enlightenment on some of this, and then once we maybe go through the deck of the slides, I'm sure that you can tell us, because there was one slide, we'll get to one slide that brings up you and your discoveries and the impact it has on side effect potential. And then that's when you can unload for us, okay?
Sure.
So we'll talk about these side effects. I really want to I think folks came here, they want to know that we understand that side effects exist.
Sure.
So again, we're not trying to destroy the medical system. We're going to focus in on the side effects for a few minutes first, if you don't mind. So let me see if I can get this up here on the screen. Okay, so in order for us to just kind of keep ourselves in the right line, the first slide here, as you can see, is the fact that medications matter. And you, of all people, professor of at the University of Medicare, what's the university again? In Colorado, School of Medicine. You understand the value of medication better than I do. So they work and they're beneficial, especially in what circumstances here, right? Under acute circumstances with chronic conditions.
Sure.
Medications are critically important. Even the young man I mentioned before, he must have had a breathing problem, so he was using something to help his lungs.
Correct.
To deal with that. So there's no question that medications are beneficial. But the other side of the coin is that they're not perfect. They come with a cost. So the benefit comes along and there's a cost. And often that warning label in the background, you've seen these medications with these warning labels on them, Dr. Prasad. Can you tell us a little bit about it?
Yeah, I mean, it's, some medications, for example, cancer medication can cause all kind of damage. For example, right now, people are using Ozempic for weight loss, for example. It has a severe side effects in terms of diarrhea, nausea, and a stomach problem. And even it has increased risk of the cancer, certain types of cancer. So these are the things that we know, and we also know how to reduce the toxicity of these kind of issues.
Very good, very good. So we know that it exists.
Most of the drugs we use have some side effects. There is no question. Some are more severe than the other, but some are always some There is no question about it. Even the medical people will admit to that they have, but benefit is better than side effects, so they use it.
Absolutely, absolutely. So what is this thing here, metabolic waste and this toxic load that is sometimes and oxidative stress that's
Yes.
connected to
Yeah, one of the most thing is that the side effects that people don't realize it, because once you see that, okay, there's certain damage of the organ or don't feeling good or immune system or kidney or any organ, they don't require why. But if the drug are doing it, they are always mediating by increased oxidative stress and chronic inflammation. These two are the most culprit. And
I
so
see.
side effects, and so if you want to reduce it, then you can reduce it by those agents which can reduce the oxidative stress and inflammation. And as we
Gotcha.
know, micronutrient is one of them, not only one, because the actually the major one, but also intestinal dysbiosis
Well,
enhance.
hang on, Dr. Prasad. We're gonna get to
No, but what I want to say, one time I want to mention it, that when we talk about the side effects and how to improve it, micronutrient is must, but
yeah.
other are equally important. So go ahead.
Yes. And I got a couple slides that's gonna help you to allow you to just bring that down for
Yes,
us.
yes.
I did a search, Dr. Prasad, and my query just simply was, what are the top 10 most prescribed medications in the United States?
That's correct. Those are the top ones.
And this is the list. This is the list that
Yeah.
it came up. But then
Yes, they're all top. Yeah, correct.
so this is the list of the top 10. So, but it also gives us on the right side there the most common side effects, just what you just mentioned.
Yeah.
And so there's probably some folks here on this meeting right now that are taking
Older people,
some.
most of the older people will have one or two or three of those.
Yeah,
Medi-
so if you guys don't mind doing this, if you're show just by raising your hands right now, your digital hand, would you please raise your digital hand one of these medications that you see on this list? So just and our co-host will get a count as to how many.
One thing is missing is the Eliquis. Is very commonly prescribed for
Okay,
heart disease.
okay.
Eliquis is not there.
You know, Dr. Prasad, I'm gonna tell you what
There are many, but this is a good example. This is a good example.
well, here's what I was surprised to see, Dr. Prasad. I was surprised to see this thing here. I see muscle pain repeated a lot. I see, like you said, diarrhea repeated a lot, and all
Yeah,
kinds of. But this rhabdomyolysis,
the muscle problem.
that surprised me to see it pop up over and over and over again.
Yeah.
That was a potential issue.
Again,
And
muscle pain is because of inflammation, as you know.
yes, yeah. So it was shocking to me to see, though, that some of the medication literally then is attacking muscle and literally has the ability to break down muscle tissue in some way. So that's kind of scary to me.
And
But
also fatigue. Fatigue is very common as well. And
yeah,
fatigue is because again, increased oxidative damages mitochondria, which produces energy. So if your mitochondria is damaged by particular drug through oxidative stress, then you will have less energy.
wow. Well, that's unnerving. So, and I'm hoping that folks, just by taking a look at this and then being made aware that they should take a look at their the medications that they're taking, that they can become more aware of what their problems may be, and it may not again be their fault. Like my mom. My mom had all kinds of health problems, but only a small portion of it was connected with the disease. A bigger portion of it was connected with the treatment for the disease. So, and that's why I'm hoping that folks will now
Yeah.
understand what you're going to tell us next. This role that micronutrients play and how micronutrients can help with the toxic part of this
Yes.
discussion.
Yeah. I think it is very only one thing that sometimes people use it, that when we talk about micronutrient, we want to talk about a mixture of micronutrient, not a single micronutrient. Because
Right.
single micronutrient, if you use it, it could be counterproductive. And because they get oxidized. If you just say older people or somebody have some kind of disease, they already have a high oxidative stress and inflammation. And if you use a one micronutrient, then they will get oxidized and then act as a free radical rather than as an antioxidant. So many experiments in the past clinical study have been done with one patient and they failed because of that issue. And so we always recommend you have to take a multiple micronutrient.
Now that makes perfect sense, Dr. Prasad. And I think that if folks can look on this screen now, they can see very clearly that your formulas are not one-dimensional. Your formulas do a lot of things, and it's not nearly there's nothing like those so-called vitamins that are out there in the world because they're just
Yeah,
vitamins.
this
Yours
is unique. Yeah.
micronutrient formula.
Micronutrient that we have not only is important what we have there, but how we take it and what we have eliminated to make sure it is maximum advantage. And so not all micronutrients that you see in the marketplace will have these unique features.
That's right. That's right. So when it comes to the energy is centered around the mitochondria.
Yes.
And if I understand correctly, the mitochondria gives off lots of hydroxy radicals or radicals in some way.
Right. And they produce it, but paradox is by themselves, they are very sensitive to free radicals. They produce it, but so until you have a strong antioxidant, they cannot protect it, excessive amount of free radicals that are being produced, and that can damage mitochondria, and that way you have less energy.
Wow. So protect your mitochondria, folks. And so we're
Very
talking about
important protection of mitochondria in all organs, including in the brain, is very, very important. And only one way to do is use a multiple micronutrient that we have.
this micronutrient formula that you have put together here is off the Richter scale, beneficial and good. There's just not a whole lot. We can't say too much about the value of micro daily and what it does. But go ahead, Dr. Prasad. Tell us a little bit more about you were mentioning some about intestinal dysbiosis and all the other formulas that you have produced that can make a difference in people's lives.
Yeah, see, intestinal dysbiosis is so important because it is not only participate in the initiation and progression of all human chronic diseases, from cancer to Alzheimer's disease. It is so important. Not only that, but when you are taking any kind of medication, they interfere with the effectiveness of your medication. But again, any kind of medication that will interfere. So the most important thing you can do for your also health, in addition to taking a micronutrient mixture that we have, but also probiotics with prebiotics, which will reverse the bad effects of a intestinal dysbiosis because they shift in the favor of a beneficial bacteria, because your stomach has also bad bacteria and good bacteria. With probiotics, we have good bacteria, and with the intestinal dysbiosis, we have predominant bad bacteria, which is very harmful for your health. So you can see that how it is important, and that's why many times people emphasize macronutrient is good. It will have some benefit, no question about it. But if you combine with the probiotics, you will have a very good results for your health. And then go
Dr.
ahead.
Prasad, before you leave that subject, right now we're hearing it in the news a lot about E. coli and salmonella everywhere.
Yeah,
Is there any particular good bacteria that would help the
that
body
is a
fight?
harmful bacteria that will, but if you are taking a probiotics, it will reverse, it will not have much effect. And And if you are really already infected there for a long time, then you have to take antibiotics to kill them right away before they go further. But that is
Right.
one of the example of a bad bacteria. But if
Mm-hmm.
you are already infected, and then probiotics can't do very much because you're in bloodstream and every place else. The only thing
Right.
they can do it is antibiotics. And when you are taking antibiotics, they're going to kill all good bacteria and bad bacteria. And therefore, you must continue to take probiotics while you are taking antibiotics.
Mm-hmm. Mm-hmm. Gotcha. Gotcha. So at the very minimum, then, if someone is here on this meeting today, they need to know at the very least then about this combination right here, that Micro Daily and the probiotic boost. That combination is great for intestinal dysbiosis, and it's the right combination of antioxidants and glutathione enhancing components so the body can fight off and neutralize many of the side
Yeah,
effects.
also that, if you are taking these two, your in the both cases, your immune function is very good. So if you get infected with bacteria like E. coli, some people might get sick if they are not taking, but if you are taking them, you may not get sick because immune system will fight off.
Oh, wow. That's what I'm talking about.
Yeah.
So that's win-win. So prevention, an ounce of prevention is better than a pound of cure. So stay on it. Okay. All right,
That's
excellent.
another one that you cannot deny it. It is so, that's why my position now had been that you can take micronutrients, is better than zero, but you have to take the whole if you want to have a good quality life and reduce the risk of chronic diseases like Alzheimer, diabetes, or any kind of Parkinson disease and so on. So this is important. Collagen peptide is extremely important. And as you know, 30% of your total body protein is collagen. That means
Wow.
it is present in all your organs, not just in the skin. So when you grow older, you can see in your skin that you are losing collagen, but you don't see in your heart also losing it, brain losing it, kidney losing it. You don't see it. So you don't take any action. But if you want to, so the question is, what is the main function? Main function of collagen is to maintain a structural integrity of all your organs. So if organ loses the collagen, it will shrink. When it will shrink, it reduces its function. And this has been demonstrated in Alzheimer's disease because when they did an MRI of the patient with the Alzheimer's disease, they found that certain area of the brain was shrinking. And of course, they have a memory loss. And then they did a clinical study, placebo versus collagen peptide for 90 days, 5 grams a day, and found out that after 90 days, they did MRI again. The structure that was shrinking was restored, and the capacity to recall memory was markedly improved. So here's a good example. Same thing might be happening in a kidney and many other organs, that if you lose collagen, and therefore it is very important. Collagen peptide is also very important for patients with diabetes because there is a hormone called incretin which increases, and when that hormone increases, then the flow of the insulin from pancreas is markedly reduced. And there is a drug, FDA-approved drug, which decreases the activity of this particular enzyme. And so, no, I think it was a DPP4. Sorry, not increased DPP4 enzyme. But anyway, enzyme. So collagen peptide inhibits that enzyme, which was interfering with the flow of insulin from pancreas to the blood. So this is very important. And so I think collagen peptide is very important. And if you take a regular collagen peptides, then you will see some benefit, transient one, because the enzyme which is degrading it, called collagenase, you have not taken care of that. But in our preparation, we have taken care of the enzyme collagenase, which is the main reason for degrading the collagen. And that's why we have used the two inhibitors, one from amla and one from white tea extract. And so now, whatever benefit you will get from collagen, they will remain for a long time.
That's phenomenal. So you actually get to keep, if you make the whatever the collagen peptide actually makes in your body, you get to keep it instead of
Yeah.
moving it back in. So that's powerful.
So it is not only your skin, you will look younger, but your all organ will be functioning normally.
Your organs will be functioning better. And interesting,
Yeah.
Dr. Prasad, just talking about how one of the side effects that was repeated in those top 10 was that rhabdomyolysis, which is the muscle
Yes.
issue. So the degradation of muscle, is it possible then that we're talking about the collagen peptide actually helping?
Well, collagen again is praised everywhere. I think, I would say that if you take all the three things that we are taking together, I think, just one agent may not be effective,
Right.
but all three agents that we discussed it will be important to see that you will see that your muscle pain is disappearing because mitochondria is protected. And also that oxidative stress is decreased, and collagen peptides, suppose muscle is always surrounds with some bone
Right.
structure is improved, muscle will be also improved.
Okay. Well, that's a big plus right there. And this is the last piece of the core four is
For
the
it is also important. It is, some people can't afford it, but it is called an essential amino acid, essential fatty acid, sorry.
right.
Essential fatty acid that our body does not make it.
Mm-hmm.
You have to rely on diet.
Mm-hmm.
And if you're a vegetarian, you get what is called ALA, alpha linolic acid. But the rate of conversion from ALA to, say, DHA or EPA has two components, omega-3, DHA and EPA. In other words, omega daily has two very important components called DHA and EPA. DHA is very important for your brain, and EPA is very important for your heart. And so really, it is a diet related. Fish is very rich in the omega-3 fatty acids, and so I think easiest way to supplement it is take omega-3 fatty acid. Then you don't have to worry about it. And if you are a vegan, these fish from where these things are isolated, wild fish, they eat algae, and algae has already made omega-3 for them. So fish does not synthesize, make a omega-3. They eat already made omega-3 from algae. So if you are a vegan, then you would not take a fish product, and therefore you can take algae-derived omega-3 fatty acids.
Okay.
Make sure in that case, if you are taking algae-derived omega-3 fatty acid, there is a hazard of contamination with lead and mercury. So make sure that they are already tested free of those heavy metals.
Very good. Very good. Thank you. Thank you for sharing that. Now, since we're on this subject of the combination of the core four, we've had many discussions about diabetes. I want to go back to a common diabetes medication and talk about the side effects from it, and then just highlight why the core four is an option that someone with diabetes might want to consider if it could potentially help them to get off of or to take less of some, if they don't need it, they don't have a need for it, because the doctor eventually will take care of that. But here's what I found, Dr. Prasad. I was just digging around again and decided to look up metformin since it was on the list of the top 10 items here. And here's metformin.
Yeah,
And
metformin is commonly used, yeah.
But I came across this article here, Legal Examiner in New York, that said in South Korea there was a problem because they detected NDMA levels that were at unacceptable level in metformin. And this NDMA is a known carcinogen. And even here in the United States, as long as the amount of NDMA is below a certain level or is at an acceptable level, it's allowed.
Yeah, I think the metformin is among all the diabetic oral medication that we are using it metformin has the least toxicity, and
Right.
a lot of people are using it. But so what happens if you just continue to use it and don't take any other action? And if you combine with Core 4, for example, that your requirement will be very little, and
Mm-hmm.
eventually doctor might say you don't need it. But
Good point.
you can see that they are very is established carcinogen. But again, all medication that we take has some side effect, but as I said, that metformin is one of the least one, and if you take a high dose, many people would take. What happens? Cancer, diabetic patient, you start with a low dose, and then it becomes ineffective. Then you increase the dose, and then once it doesn't work, then you shift to another oral. So
Yeah.
you
Yeah.
see what I mean? And then eventually, sometimes patient is in 4 or 5 different medication, which has a
Yeah.
different pathway of reducing glucose. But why to go through all those things? But suppose you are already there,
Right.
continue to do that and take this core 4. And if you get a hypoglycemic, make sure you contact immediately your doctor, because could be hazard too. So many people
Yeah.
have reported this, that if you combine these things with the standard therapy, then it could become hypoglycemic, and then so if your glucose level goes to 70 or below, you contact doctor, and doctor will advise you how to increase the glucose level.
There you go. There you go. So, for the sake of our audience listening, Dr. Prasad says a mouthful, and a lot of times it goes over our head. It goes over my head a lot of time, but I heard what he just said. Um, I brought up the point here about this NDMA being a known carcinogen. Dr. Prasad identified it right away.
Yeah.
He said this is the least toxic of all the diabetes medicines, but it still has a known
Yes.
carcinogen
Yes.
present in it, just like most other medications. So,
Again,
microdaily,
this carcinogen will
mhm,
affect by generating free radicals and
right,
inflammation.
right, right. So, here's the point then. Your formulas, Dr. Prasad, if even a cancer forms,
Yes.
high doses of the microdaily blocks the uptake of glucose and glutamine,
Yeah.
and the rest of the core 4 would benefit someone who is a diabetic, and potentially their doctor could reduce the amount of medication that they're dependent upon.
Yeah, it is a preventive dose. With the
Mhm.
cancer treatment, high dose is just for cancer treatment, not for
Right,
anything else.
right.
And the standard dose that we have in microdaily EMF is
Prevention.
enough for these kind of issues, preventing the effects of NMDA as a carcinogen together with this stand. So you can have both, best of the both world, and
Gotcha.
eventually doctor might think that, well, you don't need any more
Right.
metformin. And so,
Hmm.
but I always encourage combination until doctor decides you don't need one, then it's okay. It is.
Right. That makes perfect sense. That makes sense, Dr. Prasad. And it's clear as crystal that this is the way to go. Okay. Well, I tell you what, Dr. Prasad, I did want to share one story. We ran out of time, and I think there's a bunch of questions that folks have
Sure.
that they're wondering about the side effects of some of their medications that they may be curious about. And
Mhm.
I think Bernard may have Bernard, did you identify one of the questions that someone was raising in the chat? Okay. Um, okay, no, this is just a comment that someone made that they're intolerant to statins and other meds that reduce cholesterol. They had to stop taking them and just use I don't see the other thing here, what diet to control my high cholesterol. They tried a lot of them and they made me ill. Okay, so this is someone just commenting that the side effects for them for just the cholesterol meds was something that they could not tolerate. So they had to control their cholesterol just with through diet. So
Yeah, I
okay,
mean, they have sometimes people have with atorvastatin, um, they forget, transient amnesia, and uh, and some people can't tolerate it, some of those drugs, And so in that scenario, I think that was a correct approach. And as you know, that our micronutrient, original micronutrient, Micro Daily, was tested in Denver in a firefighter, and they improved the blood profile as good as Lipitor within a year. So it is a slow effect, not overnight effect. And so I think, even this has a anti-cholesterol activity, the other micronutrient that we have it, but you have to take a long time.
Oh, that's pretty powerful, but still with no side effects though.
And no side effects. Yeah, exactly. One thing about micronutrient is that it has no side effects. If you are using our preventive dose with or without medication, it has no side effects.
That's pretty good. Here's a question, Dr. Prasad. Can a person who has a bilateral transplant recipient utilize these products since they're on immunosuppressant drugs?
Yeah, but if you have a transplant, probably you are taking also the um, medication which prevents the rejection of the tissue.
Right.
And as you know, one of my very close friend, Dr. Bill Cole, has a transplant, and his doctor predicted that he will live 17 years, but he lived more than 30 years because he was taking with me all the vitamin that I was taking during all these years. And so, yeah. And
You
so I
said his
think,
name, did you say Bill Cole?
yeah, Dr. Cole, yeah.
Cole?
Cole, yeah.
I know him. Okay. I knew him.
Dr. Bill Cole, yeah. He was with me in Denver. And then when I migrated here, then established a lab that he was working with me for 6 years. He was my best friend.
Okay. That
Yeah.
is interesting. I think he had, if it's the same one, he had multiple sclerosis there,
And,
for a
and,
while. So he had
and
some
so I
issue.
think, in transplant cases, it will reduce the time of rejection because eventually they might get rejected. We hope not. But, if you are living for good quality life for some times, that's good enough. So he had a great time for all these years. And then finally, and he was not taking all the things that we are recommending it. He's just taking a micro daily EMF. But if you are taking a core 4 plus the digestive enzyme, and and so because some of those people could have digestive issues as well, and
Right.
and so I think those things, if you do it, I'm sure that your quality of life will improve, and the time of rejection will further extended than doctor predicted.
That's good. That's good. That's absolutely right. I 100% agree with you. I have one story here, Dr. Prasad, that illustrates, according to Iris, that side effects of very toxic treatment can be ameliorated. And so I think just sharing this one, especially for the sake of the audience that is here just to see, is it true that micronutrients can help take the edge off of side effects? Now, Iris was being treated for cancer, breast cancer. And she said she had chemo, she had radiation, she had surgery, she had, the whole 9 yards. But she describes what she believes to be the benefits that she derived from your formulas while she was being treated. So I think this may illustrate it for some of our audience right now.
Sure.
So 1 second.
Most of you know that I did have cancer. I think it was 2018. And I met I've been knowing Miss Dolores for a long time. But then, she had introduced me to the Micro Daily. So with God in prayer and Miss Levette, I decided that I would go ahead on and take the Micro Daily. And I did it before I had surgery. So I needed to get it in my system. So once I got it into my system, when I had my surgery, I did not have any pain. I did good. Then after that, I did 8 rounds of chemo. And chemo it's poison. It's a lot of poison that's going inside. Okay, didn't get sick one day. because I was constantly taking my macro daily, constantly. Then I did 33 rounds of radiation. Didn't get sick, didn't hurt. So now I'm on this thing called tamoxifen. It's the pills after cancer, and one of the side effects is the bones. I should be aching all over, but because God has prepared me along with Miss Levette to be great, of course. He allowed me to not have any pain whatsoever, and I go around. I talk to my clients about a lot of them have blood pressure problems, all of these different problems. I'm like, you know what? I had cancer, and this micro daily, it attacked that cancer. And I tell you, I'm just grateful. And that's my testimony.
Okay, so the main thing there was that she said from the chemo, Dr. Prasad, that she had no side effects, and even from the tamoxifen that she was taking afterwards.
Yeah, I
She
mean, again, tamoxifen also mediates the action by free radicals as the side effects. And so I think if you take then again, you take the best of the both worlds.
Mhm. So you really can't lose. There's no such thing as losing by
No,
adding
no.
micronutrients.
Yeah.
Does it work against your medication? Does it contraindicate with the medication?
No, I don't think so. No, none of the things that I have. The only place I said that in case of cancer, low dose antioxidant is not good during
Mhm.
treatment,
Right.
or even up as long as you have cancer, because there's a hazard that it might stimulate the growth of cancer in some cancer cases. We published a research on that issue. But except cancer, the one which we have a core 4 plus digestive enzyme would be remarkable in terms of improving your quality of life during aging and reducing the risk of almost all chronic diseases.
Right.
I'm writing
And
by the way, Jonathan, I'm writing a manuscript on this issue for publication.
uh,
Importance of core 4. No,
that,
the title of the paper, you can name the product, that we have,
right.
but the title of the manuscript will be How to Improve the Quality of Life and Decrease the Risk of Chronic Diseases During Aging. That is the title. I think I'm finished 1/4.
That's a beautiful thing. See, anti-aging is so important. Well, let me ask you this, Dr. Prasad. Back when you were originally creating a formula for the United States government, um, one of the things that we mentioned in the science brochure is how you had to prove to the IRB that there was no contraindication with known
Oh
pharmaceutical.
yeah, that took 9 months actually. The first Navy IRB Institutional Review Board, when we submitted the proposal, they took 9 months because they were asking toxicity issue individually. So we provided all answer. We testified before them in a Naval Health Research Center in San Diego, and finally they approved for the trial. So now we have started the trial, and then the result. On Marine Corps in Palm 29, which is the most dangerous place, but that is the place that get a training with noise and all kind of exposure that increases oxidative stress in your body. And many people, not many, some people leave because they cannot take it, even though they are 18 years old.
Wow,
But the training, 18-year-old training. So we
that's
ran an
intense.
experiment and we got very good result. And as you know, we also ran a clinical study on veterans, and again, we had excellent results.
Yeah, that's fantastic. We show the picture often of those two rabbits that were
Yeah,
exposed to dose of
radiation
radiation.
protection. Yeah, I mean, that was my dream that I came United States for. And not only those two in an animal model, and a human a study, as you know, that we can perform with high dose radiation on human, but but at least in large animal like sheep and rabbit, their protection. But in this case was a CT scan, CT scan, many times we go for our diagnostic tooth CT scan, and doctor
Yeah.
will say that we don't have to worry about any damage. But when they did this, it is published in Journal of Radiology, not journal, but just Radiology Journal, which is a Bible for radiologists journal. And it was published. So the result was that one CT scan, and then they take a blood from your sample after the CT scan, and they found that the number of a double DNA breaks, they call it, means DNA damage was a lot, because when you check the lymphocyte, and they use a technique by which those which are damaged shows color, they shine under the microscope.
Yeah.
And so they said, yeah. But then when we gave them a formula, just the antioxidant part of the microdaily EMF, original microdaily, and just the antioxidant component, because they wanted to have a cheap product. And they gave a patient before CT scan, 1 hour before CT scan, and found that over 55% reduction in DNA damage.
In 1 hour.
Just one dose. But we know now, and they did not know, because I was not consulted how to do the experiment. We just provided this material, vitamin, and they just one dose before. But now we know that the half-life of the free radical lasts several hours after radiation.
Mm-hmm.
So you have to treat at least one time right after exposure. They didn't do it. So it would have been a much more protection. In other words, this is the first human study done
Wow.
where they show that indeed micronutrient we have can protect against the diagnostic type of radiation, and possibly in case of unfortunate nuclear accident or nuclear war, people get exposed to, many will be saved.
Wow. That's pretty amazing, Dr. Prasad. Well, for the sake of those who've never seen these images here before, you
Yeah,
see
yeah, this
the
is a
rabbit
rabbit.
lung. Yeah, the
And
rabbit lungs on the left.
is a liver protected? You
No,
can
I think these are all just according to Jeff anyway, it was the
is a
lung.
lung. I think it is a lung, baby. It's a lung. It has
Yeah,
so long,
but it
and
looks a lot
you
like
can
the
see
liver.
that
It was burned.
placebo is just burnt. It looks like a charcoal, but
Yeah.
what is an antioxidant treatment? And this collaboration was done with the NASA in Houston, who has a collaboration with the Russian Academy of Sciences. So there were 3 institutions was involved in this study. We, NASA, and Russian Federation scientists.
Wow.
So it was not that easy job to keep a track of all these things.
No, I can't imagine how you I don't know how you kept up with it all, but it's to our benefit now that we have at
Yes,
least access to the gentleman who was the genesis of this whole thing. So we're grateful
yeah,
that you went through all of what you went through there, Dr. Prasad. It's making a difference in the lives of so many people. We can't even say enough about it. Um, so for the sake of, I just want to flip through the rest of our deck here real quick to wrap up our meeting. You have a digestive boost too for some folks who have trouble digesting things. They can also add the boost to it, will help them to break down.
yes. Because as
Uh,
we grow older, this is just the law of nature. As we grow older, our capacity to produce enough digestive enzyme is reduced. And
mhm.
therefore, you can't digest properly protein, carbohydrate, and fat.
So
And
this will
that
take care of
becomes
the
very
gas and
important.
the bloating.
Yeah. And that causes bloating, constipation, and because can get digested.
Okay.
And
Okay.
so
So that's
digestive enzyme boost is very important. I take every day
yeah,
before
this is a
meal or
must here.
after.
Yeah, this is a must. And the CBD boost is the highest quality CBD in the planet. I
CBD
take
is highest
three
quality, not only that, but especially people who have certain disease and you are worried about depressed and anxiety, or many times Alzheimer people have that kind of symptoms. CBD is so critical And CBD also reduce your stress, depression. By mechanism, there are three mechanisms by which they do it. First, they increases the serotonin level in your body, your brain, serotonin, by stimulating the receptor for serotonin. That's one. Second way, you do the two ways increase serotonin level in your brain. One is that it stimulates this synthesis of the serotonin. And second is, if serotonin is already formed, they get degraded by the enzyme. And so CBD acts as an inhibitor of serotonin reuptake so that they don't pick up by the cell and get destroyed. And
Oh, wow.
this mechanism, reuptake, inhibitor of reuptake, is also a FDA-approved drug that is used for depression and anxiety in human. And
Wow.
it has some toxicity, and CBD has no toxicity.
Wow.
CBD also increases dopamine level. And dopamine level, if you have brain increases dopamine level, you feel very happy. Third thing is CBD also reduces the production and release of glutamate. And if you have excessive amount of glutamate, you become hyperactive, you have anxiety disorder, you have all kind of problems, just like autism people. And so CBD reduces that. And therefore, it is very nice thing to do that. So
Wow.
anybody who has that problem of anxiety, depression, and then
That's
CBD
powerful.
is a must for them. I don't
That's
have any
powerful.
anxiety, depression, but I always take it for make
Oh,
sure I
yeah.
don't
Oh,
get
yeah.
worse. I'm growing old.
Dr. Prasad, I take it every single day. The brain boost is phenomenal, folks. For those of you who want to just kind of boost things up a little
Yeah,
bit, the
sleep boost
sleep
is
boost,
fantastic. I take every day.
that's off the Richter scale. And there's one more that I don't have a slide here, the heart boost. So for those who are dealing with
I boost is
cholesterol,
also very unique. Yeah, as you know, that we added a one atorvastatin. No, we have a lutein, zeaxanthin, and astaxanthin.
that's it.
And,
That's it. So
and
excellent for
yeah,
cholesterol, excellent for blood pressure, excellent for the heart, excellent, excellent, excellent. That's all we can say.
yeah, exactly. And people have testified. I'm not testify, but our customer have said it how great benefit they are deriving from these
Oh, yeah.
things.
Oh, yeah. I won't go a day without it, Dr. Prasad. It is absolutely the best.
One
So,
question I saw that on the chat was Ozempic.
yeah,
Ozempic has no question, it has a weight loss and it is a classical, initially it was approved for diabetes. Now everybody is taking Ozempic as a weight loss, but it has severe side effects, diarrhea, constipations, and also the cancer risk, certain types of cancer. And so if somebody develops a formula which can produce not only GLP-1, which Ozempic produces it, but this is the way it works. Produces one hormone which are generated from the intestine called GLP-1. But if somebody also has a product or agent which not only produces GLP-1, but also another hormone secreted by the intestine, which is a cousin of GLP-1, is called GIP. And this one protects the toxicity of GLP-1, and it is not as effective as GLP-1 in terms of in a diabetes or reducing weight, but it protects it and do something. So I'm looking for an agent which can do both, produces GLP-1 as well as GIP at the same time.
oh,
That
wow.
Ozempic doesn't have it.
Okay. Well, that may be one of the things that you have to go ahead and formulate for us, Dr. Prasad.
I'll have it, yes, someday.
We'll put,
I want to lose weight too. I'm 165. I want to be 150, so I need a 15-pound weight
yeah,
loss.
yeah, I hear you. Well,
But
for the sake,
so let us see what happens. I mean, no.
yeah, we'll see. We'll see. Well, for the sake of those who are here for the first time, This is the very minimum that Dr. Prasad recommends. We told you was the basic bundle. That was just the micro daily and the probiotic boost, but this is the core four. So gives you the essential four, and then you can add on any of the other boost products that you need help with. But this is what we recommend. So your cost for this is just, I think it's a little more than $200 now. The price went up by $1 or $2 because of inflation, but still you're looking at somewhere around $200 for the core four. And the retail on that would be well over $310, $320. So these are the basic bundles. The basic bundle on the bottom, the premium bundle, and the core four. So just get back with the person who invited you here to this discussion today, and they'll help you to set up your subscription for it. But you want to do it as a subscription. So preferred customer is what you want. Don't buy retail. I don't recommend that, but just agree to try it for 90 days. It takes 90 days for you to really know whether it's helping you or not. And I pretty much guarantee it will help you. There's no question about it. If you're of the mammalian species, it's going to help you. If you are a mammal, it will help you, because all it's doing is raising your body, boosting your body's immune system, reducing oxidative stress, and it doesn't matter what kind of medications you're taking, the side effects will be, at least to some degree, helped. So we're not saying that this will neutralize all side effects, because this will not treat or cure any disease. So that's what we told you at the very beginning. But you certainly will find that your body will be more nourished with these nutrients going into them. So just get back with the person who invited you to this discussion. But next week now, we want you to make sure that you mark it on your calendar next Sunday, 5 o'clock. You'll hear a lot of amazing testimonials. The ambassador of the company, Jeff and Helen Ashby, will be taking the lead, where you get to tell your stories. So if you've got some benefits that you've been having from any of the Engaged Global products, please bring that to the discussion next week. The week following that, we'll be talking about side effects again with the maestro, Dr. Prasad, if he's available. We'll be discussing this. We're following through on this discussion, because side effects are for real, and everyone's dealing with a bunch of them. So we'll have some fresh, new research there to present and help you with that. So just as a closing remark, just remember, we strongly recommend that you seek the competent medical advice of professionals that you trust. And when it comes to making decisions about what nutrients go into your body, they should be evidence-based. They should be proven. And you've got Dr. Prasad here is the man who has proved exactly what these formulas are, and there's no question about it. It's the most scientifically validated micronutrient supplements in the world. So you can add this to whatever your doctor has recommended for you. It's safe to add it to that, because it's just the food that's missing from food. We highly recommend that you lose your relationship with the couch. Lose your relationship with the couch.
Right.
Get moving. My recommendation, Dr. Prasad's recommendation, at least 7,000 steps a day. 7,000 steps a day. Get walking. Instead of finding the closest spot at Walmart or wherever you go shopping, park at the end of the parking lot. Get those steps in, folks, and manage stress. Manage stress. The CBD will help you to manage stress, but that's what we recommend. And I encourage you to do that if you want to help your body help you. And toward the end of the month, I saw it in the chat, Bernard told you, Bernard Dean and Jeff Ashby will be hosting a program where you will get to ask questions. You will be able to ask questions until you are blue in the face, folks. You'll be able to ask questions, ask questions, ask questions. So you can look forward to that also. So the month of December is going to be loaded with all kinds of beneficial things that you will be able to enjoy. You'll be happy that you came to it. So Dr. Prasad, thank you so much again, sir, for your being willing to
Thank you, Jonathan.
join us on
Enjoyed
programs like this. We just can't say it enough, Dr. Prasad. We appreciate what you do and how you bring so much knowledge and information to us and our lives. I think everyone will have to admit that our lives are all being made better because of the dedication and the work that you've done